Good morning, everyone. Thank you for joining us today, and welcome to our COVID-19 community update. I'm Tina Friesdecker, President and CEO for Spectrum Health, and I'm joined by Dr. Daryl Amucci, President of Spectrum Health West Michigan. Daryl, if you want to say hello.
Good morning, everyone.
And Dr. Lauren Hamill, President of Spectrum Health Lakeland. Lauren?
Good morning, everybody.
Thank you. We wanted to take this time to provide you with some of the latest information that we have on COVID-19 in our community and to answer your questions. You are welcome to post your questions in the comment section of this Teams live event. We are recording this so we can post it as well to others that weren't able to join. I apologize for having to shift the platforms. We've increased strengthened our cybersecurity measures. So we want to make sure we continue to be secure, but also want to communicate with our community. As everyone knows, COVID-19 cases are on the rise. We have tripled the number of patients with COVID-19 in our hospitals from last spring. And unfortunately, we are going in the wrong direction. We'll show our dashboard here, and we see that we have over 200 people with COVID-19 in our hospitals. The positivity rate is around 11 to 12% for a 7-day average. And we're seeing that this is impacting all ages. Thankfully, we are not seeing the disparities that we saw last spring. We are also closely watching what's happening throughout the state of Michigan, in other states in the US, and across Europe. And when we look at our curve, it mirrors some of those other countries and states that have a significant increase in their cases and have a strain on staffing and hospitalizations. So we know very clearly that this second wave is hitting us and it's hitting all of Michigan, and we are on a frightening path. This increase is creating intense pressure on our hospitals and our team members. We're going to share with you a couple of the statistics from Dr. Amucci and Dr. Hamill, and then we'll also talk about things that we know work. But I want to highlight just one thing. There were behaviors that we could do when the positivity rate was 3% or below. But now that we're seeing our positivity rate be at that 11 or 12% for a 7-day average, there's things we really shouldn't be doing anymore. We really need help in slowing the spread with our team members, with everybody, so that our team members can care for the people in our community and we can continue to care for all the health needs of our community. I know that we are also tired of this virus. So are we, but it is here and we are taking it extremely seriously to make sure that we continue to do our mission, that we improve health, inspire hope, and save lives, and we are responding and caring for people with COVID-19 as well as other healthcare issues. We know the simple things that we can do, and Daryl will comment on those in a few minutes. But there's other things that we can do, such as starting to limit where we go and who we hang out with. Trying to stay within your own family or the small bubble. Always wearing a mask, and something that I ask on a regular basis to myself: is it really worth the risk? And so these are things that are areas that we suggest that you start thinking about, helping us figure out how we can slow this spread, because we are seeing a significant increase, and it's shown in the numbers that are listed here. So Daryl, I'll turn over to you to see if you could comment on what's happening in West Michigan, and then we'll also hear from Lauren about what's happening in Southwest Michigan. Daryl?
Thanks, Tina. And if we could advance the slide, I'd first like to start showing you what's happening across the state. And so every single region of our state is seeing a very significant uptick. And over the course of many months, particularly over the summer months, we saw small increases and decreases of testing positivity. But this is now a marked increase in the number of cases. And you can see on the far right here that this is now becoming almost vertical. And that is what you see in other parts of the country and other parts of the world when you are in a surge, which we definitely are in. Next slide, please. And this is a slide to show you, and I have two that are very similar, to show you this uptick in positivity of cases is happening across all age ranges. So we're seeing this in the very young, we're seeing this in teenagers, and we're seeing this in young adults. And as I'm sure most of you know, during the summer months in parts of the country, we saw a big uptick in young adults. But if you move to the next slide, you can see what is even more concerning. As we get older and start to have a little gray hair, we're now starting to see older age ranges with higher positivity. And as we know, while this can impact all of us, there is more morbidity and mortality the older you get with this disease, and we are clearly seeing this across every age range. Next slide, please. And so this is a slide, it's now a little bit out of date because it only goes through the end of last week, but it shows what in essence is the second surge. And I've been telling people for the last week that we never in West Michigan or Southwest Michigan really had a first surge. We had what we thought would be a surge, but it never really came here. And we are now seeing a very large increase in hospitalizations. The blue bars are within our Spectrum Health facilities. The light orange is Metro U of M, and the dark orange is St. Mary's, and this is within Kent County. And we are seeing very significant upticks in hospitalizations, record hospitalizations for COVID actually in all. And if you move to the next slide, and very specifically, this is our data for the Spectrum Health West Michigan hospitals, which is our Grand Rapids hospitals in the 13 counties surrounding. And you can see that in late May, we peaked at 61 total inpatients within those hospitals. As of yesterday, we were at 180 total inpatients, so triple what we ever saw. And you can see that slope of the curve is incredibly vertical, and it really does not show any sign of coming down. Next slide. And this is for Lauren to describe a bit about Southwest Michigan.
So I don't have the admissions slide, but our admissions are up 1.5 times what the peak was back in May or so. This is just county data on COVID cases. I would just draw your attention to the graph on the lower right-hand corner. Those are tests, and you can see that's also heading up exponentially. We have tracked usually 3 weeks, 2 or 3 weeks behind West Michigan. We expect to have the same experiences occurring in West Michigan. And all I would say is anything we do to be careful today is not going to affect next week's curve. That's already kind of in the books. You know, that was our behavior last week. So we expect this to get worse, even if everybody behaved perfectly right now. It's going to get worse for a week or so before it starts to decline. So I certainly support what Daryl and what Tina was saying is it's a scary trend we're seeing in healthcare. Both in West Michigan and in Southwest Michigan. Daryl.
Thanks. And if we can move to the next slide. So if you've joined one of our community town halls before, you've seen us show surge models, and we've adapted and updated this over time. This model came out actually last night. I know it's a little bit of an eye chart, but I want to call your attention on the left are the Spectrum Health West Michigan hospitals and census, meaning the number of inpatients. On the right are Spectrum Health Lakeland hospitals. And what you can see if you follow that black line is that you see a steady uptick in the number of inpatient admissions. And that would be what we'd call our best fit or most likely line. However, the error bars, meaning the blue and the red, show where this possibly might go. And our analytics team last night sent me a note saying, given the massive uptick in positive tests we've seen in the community over the last 3 to 5 days, they actually believe that we're headed much more in the direction of the upper red line than we are to our traditional line of best fit, which is the black line. And then if you look at the yellow horizontal line on both, that is when we start meeting our internal normal capacity for beds and staffing. And you can see that on both curves, it shows that either now or in the coming days, we will start meeting our normal traditional census occupancy limits. And that is because we're still caring for people with heart attacks and strokes and cancer and so forth. And so we have very, very diligent plans of how we can expand internal capacity, change wards to ICU wards and so forth. But ultimately, if we hit the red line and continue on the red line in West Michigan without significant change in behaviors, we may well exceed our capacity both within Spectrum Health hospitals and definitely within our partner hospitals across the region. Next slide, please. And so what Tina had alluded to and Lauren mentioned as well, it is time, hopefully, for all of us to try to help our community prevent this. And if you could move on to the next slide. And by now, this is getting, a little bit, I think, tiring for all of us, and we recognize it. I can tell you that as a physician, I hear not infrequently, does this really help? Do masks even work? Because we're still having COVID and people are wearing masks. And the short answer is, this is the only way we will not hit that red line and beyond. If you look across the world, the data is very clear that unless there are true lockdowns, which obviously we're all trying to avoid, or people very adherent to masking, social distancing, and hand washing, the curves don't come down. And the analogy I give for masking is that we all, when we're in cars, hopefully wear seatbelts. People still die in car accidents, unfortunately, but seatbelts help minimize that likelihood of death. Masking is the same way. It doesn't 100% prevent an infection with COVID, but if we all wear them, it decreases the likelihood that will happen. Next slide, please. And so, Lauren, I wonder if you could maybe comment a little bit about proper mask wearing, because we see that not happening as well.
I certainly can. There are all kinds of masks out there and face coverings, and they all work to some extent. But it's really important that they cover your nose and your mouth at all times. And also, it's really important not to handle your mask. You see behavior where people's hands are around their masks all the time. That's a time where you should re-sanitize your hands and recognize that you have accumulated germs that you can give to yourself or that you can give to others. And I think it's really important to remember that most transmission that's occurring now is asymptomatic transmission. That's not people that know they're sick giving it to their friends and neighbors. Those are people that have no symptoms or only minimal symptoms, have not been tested, and are giving it away. And the mask is the best barrier between those germs and your respiratory tract where those viruses enter your body. So I'm a strong believer in masks, but they have to be worn well, and you have to keep your hands clean. Thanks, Daryl.
And the only other comment I'd like to make before passing it back to Tina is that we track our team member positivity every single day. We're very diligent on this. And over the last 2 weeks, we've seen our team member positivity rise very substantially. And we do very strict contact tracing. And what we've learned is that even for our team members, the doctors, nurses, all the other workers that come in our clinics and our hospitals, that the vast majority of where they're getting COVID, where they're exposed, is in the home environment, is in the social environment outside of the workplace. So we have come back to everyone and really emphasize this, and we're hoping that you in your workplaces and with your family can do the same. So first of all, in a public setting, wear a mask. Eat or drink only when you're at least 6 feet apart. And we saw in our own workplaces, people just sitting down and eating. That's a time when we all have to have a little bit of social togetherness, but being too close when it's this much prevalence in the community is very frightening. Obviously, washing hands. If people are sharing things, you really have to sanitize those. And really, one of the things that's so hard is asking people to be accountable to each other. And we have very much ruled out potlucks and ordering pizza for large groups, all those things that we normally like to do, we do. And we also found that we have many team members who carpool, and that's a good thing, obviously good for everyone, but they weren't wearing masks when they were carpooling. And if they're not in the same household, we've either asked them to limit carpools or wear masks. Next slide. And then finally, and we get a lot of questions now about the holidays. I don't think any of us can be so specific as to say what people can or can't do, but we can offer advice that right now is very different, as Tina mentioned, than the summer months. And in the summer months, when we had so little COVID circulating our community, gatherings, particularly outdoors, were okay. Now, particularly, although this week is an anomaly, as the weather gets colder, there is a lot of concern that if we start seeing this 10, 15, 20% positivity in the community and we gather it all indoors unmasked, even with close friends, with family that aren't part of our household, that we will have a lot of spread of COVID, and we're definitely seeing that already now. So we just ask everyone to be smart and to try to help their friends and neighbors understand the same. I believe that might be my last slide, and if so, we'll turn it back over to Tina.
Thank you so much. And so right now I don't see any questions in the chat, but there's a couple that I've heard from our community members that I want to make sure we address. One of them is the vaccine. And so before I go to the vaccine, I just want to encourage everyone to get the flu vaccine. We have supply for that, as well as others in our community do. And so we encourage you to make sure you have the flu vaccine. And then for COVID-19, there's a lot of information coming out about the vaccine, likely in the spring of 2021. We've done a lot of work to be prepared for that, to plan for distribution and other processes to make sure we're there, purchasing refrigerators and such. And we don't know all the details for it, but we're really working to make sure that we are as prepared as possible for the vaccine and trying to understand to ensure that it is safe and has efficacy there. Lauren and Daryl, would you add anything for the vaccine?
No, I agree with what you said. There's been a lot of reluctance about the vaccine. It's been politicized a bit. We expect that vaccine is going to be safe and effective, and we certainly are going to keep track of that for our own selves and for our staff. But that is the only way this pandemic is going to ultimately come to a close, is either we all gotten sick or we start to vaccinate. And I am certainly hopeful that vaccine arrives soon, and just encourage you all lean in and take the vaccine.
Thanks. So there's a question about the positivity rate calculation. Daryl, can you comment on the positivity rate calculation? And can you also comment on what we're seeing in terms of acuity of patients within our hospitals?
So positivity rate is essentially a day-by-day calculation. We take the number of tests we perform as the bottom or denominator and the number of positive tests as the numerator on top, and it's simple division. We also average that rate over the course of 7 days and display that as well. And so any given day you might have a spike up or down, but the average of 7 days is what we really follow. And actually the most recent data that just came out within the last 15 minutes, we're now up to an 11.9% positivity rate. Just for comparison's sake, we were about averaging 2% over most of the summer months. This is significantly higher than before. And this means that people that come to get tested, you have now more than a 1 in 10% chance of being positive. I was just connecting with my counterpart in Muskegon at the Mercy Hospital, and their average rates have been over 20% for many days. So we are seeing a lot of positivity. And then as far as acuity is concerned, this is probably the most challenging thing about this disease. As Lauren mentioned, there are many people who we know are asymptomatic, many people who have kind of mild viral symptoms or worse, but can remain at home. But there are many people, even young, healthy people. We have pediatric patients in our hospitals right now that are there with COVID-19. You can be young and healthy, you can be older and have many comorbidities, but this strikes people and causes them to be very ill. This is a multi-system disease, meaning even though it's a respiratory illness, it can affect the brain, the heart, the lungs, the kidneys, and so forth. And we absolutely have had deaths in the hospital. Our death rate within the West Michigan hospitals, if you're admitted, is just under 10%, meaning that of 1,000 people that have been admitted, almost 100 will succumb to the disease. That is primarily an older population that dies, but we have had younger deaths too. So this is a very real disease. And unfortunately, while our treatments have gotten better, we don't have a cure as of yet.
Thank you. There's a question about people wearing small plastic face shields that are perhaps 2 inches by 2 inches over their mouth. Can you discuss their effectiveness? So, Lauren talked about how the mask needs to be over your nose and down to your chin. So you wear a mask here. We are also within our facilities wearing shields that cover our eyes, or you'll see glasses there, especially when we're specifically caring for COVID-19 patients. It really needs to be something that covers your nose down to your chin there. Having an open thing where your cough could go over the plastic doesn't work. It's not very effective at all. Lauren or Daryl, any other comments about effectiveness of that?
No, I agree. A little mask is maybe a little better than no mask, but you need full coverage, and you need to make sure that coughs and sneezes do not escape if possible. And that's where a well-fitting mask is much superior to the little shields.
And I would liken it to putting a seatbelt over one of your legs. Not necessarily the best way to get protected in a car accident.
Thanks. So there's a question about isolation versus quarantine. Can we describe the difference in that? And then related to that, questions about children have been quarantined because they were in close contact of COVID positive students. Should those children who are quarantined be tested for COVID if they're asymptomatic? Can you answer that question, please?
Yeah, this is obviously the challenge of this disease, is that transmission and when people get it may be very different depending on who they are. So there really isn't a formal difference between isolation and quarantine. They essentially mean the same thing. And ultimately, if you either have COVID, suspected COVID, or you've been in close contact, meaning unmasked less than 6 feet for a cumulative total 15 minutes within a day, you need to quarantine. And the question often comes up, and I have kids that actually, I have a child that was quarantined because of a soccer team that had a positive test a few weeks ago. If someone is quarantined at home because of an exposure, it is not recommended to get tested, because that testing doesn't at all change what that person needs to do. That person needs to quarantine for 14 days from the date of exposure. And if the test comes back negative in 3 days, 5 days, 7 days, it doesn't actually mean that they might not test positive a few days later. And so because testing still has constraints across the country, the current recommendations are that testing won't get you out of quarantine, and you don't absolutely need one during a quarantine, unless you have symptoms.
And our health department friends will use the term isolation for somebody who's tested positive, symptomatic, and they've asked them stay home. But I agree with Daryl. It is separating you from others either way, whether or not you've tested positive or not. Those terms are often used interchangeably.
I think it's really critical that if you have symptoms or if you've been exposed to somebody, that you do take the necessary precautions and don't go out in the community. You can get tested if you have those symptoms or if you think that you need that, that's one way to slow the spread. There's a question about between Thanksgiving, Christmas, and New Year's unsafe gatherings. What would be a best guess as far as when this current surge will be reasonably expected to conclude? As Daryl and Lauren mentioned, our information that we see when we look at the positivity rate, it's already lagging by a week or two. And so we expect this to continue going forward for the bulk of November. What we see in other states is when you put measures in place to limit it, it does start to come back down, but it's usually that 2 to 4 week time frame. So that's what we're seeing from other areas, but it does depend on when we really impact this and see a crest. Daryl or Lauren, any other comments?
No, I agree with you. I'm not a prophet and don't have a crystal ball, but I don't expect this to be decreasing probably until we're into January or February. I hope I am wrong, but with holidays and gatherings, there are a lot of things that could make this worse. If we commit ourselves to be careful, if we commit ourselves to protect ourselves and those we care about and those we work with, we can change the course of this, but it requires diligence. And you recognize on social media and other platforms, there's a lot of disinformation. There are a lot of folks that are saying, I'm tired of this. It's fake. It's a hoax. It is not. This is serious, and it's putting our friends and neighbors' lives at risk. So I think it's going to get worse, Tina, unless we all commit to behave. And to Daryl's your early comments about, and we're going to have to probably quit doing some things we're choosing to do now, like going out to eat, like bars, like large gathering, like hanging around other people that aren't wearing masks. Those are places we should absolutely avoid.
Yeah, and if I could just add 2 quick things, Tina. Number one, the one we all feel comfortable prognosticating, given that we're already a week into November almost, is that the likelihood that this will be diminished enough to make Thanksgiving quite safe as a gathering time is pretty much close to zero. So, I can tell you that my family, we personally have changed our Thanksgiving plans as a result of what we're seeing. And then secondly, and I just want to emphasize this more than anything, the biggest risk that we run as a community with this surge of COVID is really a combination of so many people getting COVID that some of those people will get very sick and dying. And secondly, and this is what we saw in Italy, this is what we saw in New York, this is what we saw in Detroit early on, and there's great data for this now, that when COVID becomes so overwhelming to a community, when all of the hospitals are overflowing with COVID patients, and I want to remind you all that Beaumont early on converted a Starbucks in their hospital to a makeshift hospital ward. That's how many patients they had. When that happens, it is almost impossible to provide normal care in a normal way, meaning heart attack, stroke, car accident, cancer. We will do our best, and we are doing our best to do all of that now and keep it at the high levels we always have. But when you start becoming almost in a warlike state, everything falls down across the entire system, and that is what we're all trying to avoid. And the numbers we're seeing now, if there's not significant change in the population and allowing that curve to go down, that is really, I think, our biggest fear.
Thank you, Daryl. That is, you summarized that very well about what we talk about every single day and how we always want to be there taking care of our community, and we'll do that with COVID, but it does put this at risk. And so we, as Daryl said, we are doing our very best to care for all the needs of all the people in our communities, partnering with others to make sure that we do so as well. And we appreciate all of your help in slowing the spread and following the recommended guidelines. Should you have additional questions, we're happy to answer those for you. But for right now, we've taken a half hour of your time, and we want to make sure you have the opportunity to go share this with others to, deliver this message that we are in this together and we need our community's help. So thank you so much for today.